Have Dr. Vishnupriya Soman. Go ahead, Dr. Vishnupriya.
A warm good morning to one and all. My topic of presentation is analysis of clinical characteristics, causes, modes of treatment, outcome in patients with acute comitant esotropia. Acute comitant esotropia is an acute onset esodiation developing in previously straight eyes. It is a type of non-accommodative comitant esotropia often associated with diplopia. It can occur in older children, adults, and even in elderly. Coming to the relevance of the study, although it was found to be 0.3% only 0.3% of the total strabismus, its incidence is increasing in this modern era of smartphones and visual devices. It is divided into 5 types. First one is Swan type, because of the disruption of the binocularity. Second one is the Berrien-Franchot type, which can have minimal hypermetropia and sometimes associated with the physical or psychological stress. Third type is the Bilchowski's type, which is seen in patients with moderate myopia, convergent spasm, and divergence paralysis. Fourth type is the refractive accommodative type, characterized by high hypermetropia that can be adequately controlled with the refractive correction. Type 5 is the lesser common variety associated with the posterior cranial fossa tumors. The treatment options are conservative treatment including spectacles and prisms, surgery, botulinum toxin A injection. The aim of the study is to assess the clinical characteristics, causes, modes of treatment, outcome in patients with acute comitant esotropia. The study methodology was a hospital-based prospective observational study with a sample size of 30 and included the patients presented to the Department of Pediatric Ophthalmology at a tertiary eye care hospital in Kerala between the duration of December 2022 to May 2023. The inclusion criteria were age of onset of esotropia after 1 year, acute onset comitant strabismus with normal ocular movements, photographic evidence of absence of strabismus before the onset of esotropia, and the exclusion criteria were history of any eye disease or prior ocular surgeries, amblyopia, history of head trauma, previous history of strabismus, systemic diseases. The parameters evaluated were best corrected visual acuity, anterior segment and posterior segment examination, orthoptic evaluation including the binocular single vision, stereopsis, near and distance deviation measurement. All patients underwent cyclopagy refraction and imaging to rule out the CNS pathology. Patients were followed at first postoperative day, 1 month, and after 3 months. At 3 months, inquired about the subjective improvement in the symptoms, change in the angle of deviation, best corrected visual acuity, stereopsis, and side effects, if anywhere, noted. The treatment was considered to be successful if the deviation was less than 10 prism diopter. The results of the study was most of the patients were males, that is 67%, 46.7% of them were belong to the age group of 11 and 20, followed by 6 to 10 and 21 to 30 years. Most of the patients were emmetropic, followed by myopia and hypermetropia. 90% presented with the deviation of eyes. Out of 30 patients, 63% were students, 17% were preschool children, and 17% had office job. 60% used both smartphones and books, 17% used smartphone, laptop, and books, 13% used smartphones alone, and 10% used smartphones and laptop. In our study, 80% of the acute comitant esotropia patients were belong to the Bilchowski group, 70% included Berrien-Franchot type, and 3% belonged to the neurological type. The treatment given, 33.3% patients were treated with the surgery and botulinum toxin, 26.6% of them were prescribed glasses, 6.6% of them were given prism, and 3% treated with the surgery and Botox. On follow-up at 3 months, out of 30 patients, 29 patients, the treatment was successful. Coming to the discussion, Chai C et al. Reported the possibility of increased gadget use at close distance results in acute comitant esotropia. Most of their patients had a history of smartphone or computer use for more than 5 hours per day. Luang Tong et al. Found out that the deviation, angle, and stereoacuity recovered when treated with botulinum toxin A. Our study results were comparable to the study. The conclusions were most of the patients were emmetropic, followed by myopia and hypermetropia. Botulinum toxin A is a good choice in acute comitant esotropia. Excessive near work can have a role in the development of acute comitant esotropia, and neurological imaging is mandatory for all those patients. Thank you.
A very interesting study. Firstly, I would like to point out, so time well managed, very good. Secondly, I would like to point out the color scheme that you have used is a little difficult to read. Just go back a few slides. Yeah, so it's all multicolor. But not only that, if you go few more slides back, you have green on green sometimes. Okay, so a few more slides back. So this sort of color combination is very difficult to read, and also the text. You have written the entire text as a paragraph. Never do that. This is something you will say, and here you see chart title. Yeah, the chart title is a default thing of the thing. So don't keep chart title and all that. Make sure you modify the charts to put your title there, or remove that completely. And this green on green here and the black on dark blue, it's not visible. Okay, and all this data which you mentioned, it's what you will be saying. Okay, you will look at the chart, you will point at the chart and say 90% percent to the deviation of I is this. So that if you have presenter view, that would be what you will put in the notes, or that is what you will memorize or you'll have in your notes. Okay, you will look at it and then you will say this. You won't put the whole thing there as a paragraph. Okay, so
Either you put that or either you put this. Either the graph or the text. You remove the text, you put the graph, and then you can talk on that. That's
but don't put it as a paragraph. You will have to talk about
Talk,
it. You have to say 90%, point to the 90%.
Nice, confident talk, Vishnupriya. Congratulations. And what is the age
Age,
age of the
we have
patients?
included all the esotropia patients, acute onset esotropia patients above 1 year of age, to exclude the infantile esotropia. And the lowest age we got was 4, and older was 27. Yes.
27. 27 also will come in
Yes,
the pediatric
yes,
OPD
yes, madam.
because of the squint. Okay, so you have included an infant's photo there. That is what I was asking. What was the age in the introduction? No, one small
That
baby's photo.
um, this madam.
No, second next slide.
And this madam, only to the increased phone use
So you
and
have
all.
not included your patients' photos, no?
Yes, madam. Here in the
Ocular, yeah.
here.
Okay. So you found out that 33 percentage had to undergo surgery. So this is a significant impact, no? So what is your advice regarding prevention? Any
All
counseling or
the
anything you're planning?
Madam, almost all studies found out that the uncorrected refractive error is the most common cause of acute comitant esotropia. But in this study, we found out that the emetropic patients were more, and their phone use and visual devices use were more. So it is not the uncorrected refractive error. The near work is itself the most common risk factor for acute comitant esotropia.
So what was your sample size?
30, madam.
30. So how did you know? How did you exactly find out how many hours they used and all?
There was a table which is showing
You put a questionnaire to the patient you
yes,
gave.
madam. Yes, madam. With the questionnaire, the 1 day is divided into the duration of near work. That is less than 3 hours, 3 to 6 hours, 6 to 12, like that. And also inquired about how many weeks or months about the patient. If the young inquired
That is all put here, no?
the
How
chart,
many
the
hours of usage?
performa is not included, madam. But the
But in the other studies, they have told about the hours of usage, no?
yes, madam.
Okay.
Yeah, can you go back to the inclusion criteria?
just wanted to ask if all the cases coming to the OPD was taken into
Acute
consideration.
onset comitant type
Yeah,
of esotropia are included.
everybody. Okay.
It's a very rare type with 0.3 percentage incidence only.
But more towards those who are using smartphones, is it?
From the history, it
Yeah.
was
Okay.
like that.
You can update the title to be little more, I mean, this is fine. This is fine as a title, but you can make the title little more appealing by changing something like that. No, something about if all of them were due to device use or something, you can mention possible effect of device use or something like that. You can add to make it more appealing. Here you have mentioned everything, like the methodology, whatever you have analyzed, you have put in the title. That is also fine.
Materials and methods you have to tell. How do you
Okay,
find
madam.
out how many
Okay,
hours
madam.
they're using, which digital device
Yes.
they're using? Because larger screens will be better than smaller
Smart.
screens. So smartphones or other wider screens they're using. Like that you told you have prepared a questionnaire. You can put in the study.
Madam.
And it will be good to show the questionnaire in the presentation, one sample of how it is. Same thing, methodology should be repeatable. So somebody who sees this will be able to go back and do the same thing. Or you can just mention, okay, the questionnaire is available on request, something like that. Yeah, if you have a validated questionnaire already existing, always go for that. You look for it, you might find it. Other studies would be there, international studies, who might use a validated questionnaire, pre-validated questionnaire. You can use
From
that.
the questionnaire, many studies are using the format like the hours and all. From that only, I took the
Yeah, so you
Did
don't
you
modify anything, you
modify
use
it
the
or
same thing.
not modified.
the
It was,
same thing?
but
Yeah.
not about the acute comitant esotropia, but about the increase of smartphone use and myopia progression. Like that was the
So I think
study.
you should mention about that also. The questionnaire, you should actually display the questionnaire and show that.
It'll add more value when you say that a validated questionnaire was used. This is a validated questionnaire which was used. It gives more value to the study.